every day. Thousands of people walk into dental clinics asking for, like, the ultimate social media smile. And they walk out having permanently mutilated their own healthy teeth without even realizing what they've just done.
Yeah, it's a huge issue.
Right. I mean, picture this. You're scrolling through your feed, and you see that perfect before and after shot. Someone with a smile they've been hiding for years. Maybe it's severely crowded, or, maybe the teeth are overlapping, and suddenly, boom, there's a jump cut.
The magic of the internet.
Exactly. Weeks later, they've got these perfectly straight, bright, white, flawless teeth. There are no metal brackets, no clear aligner trays to swap out for 2 years. They call it instant orthodontics.
Right, which sounds amazing, obviously.
It does. If you've ever felt insecure about your smile but dreaded the idea of adult braces, it looks like an absolute dream. You just, skip the heavy lifting, glue on some porcelain veneers, and you're red carpet ready.
It's an incredibly seductive narrative, isn't it? I mean, we live in this algorithm-driven era where we expect everything on demand.
Oh, totally. Next day delivery for everything.
Exactly. We want fast, shocking transformations because, well, that's what gets rewarded online. But as with most things that seem like a magic bullet, the reality beneath the enamel is vastly more complex.
Yeah, I bet.
We're looking at a fascinating intersection here. It's the exact point where our modern cosmetic desires collide head-on with our fundamental structural biology.
And that collision can actually be pretty violent if you don't know what you're asking for.
Oh.
Okay, let's unpack this. Today we're doing a deep dive into some really insightful clinical notes and research shared by the team at Vinnova Dental.
Right.
Our mission is to uncover the biological reality behind this cosmetic dream. Like, can you actually just skip the braces and slap on veneers? Or are we falling for a digital illusion?
Well, to start, we have to look at the physical mechanics of what a veneer actually is and, more importantly, what a living tooth is.
Okay, lay it on me.
When you see these incredible instant transformations online, you're only seeing the surface level, literally. You're seeing the architectural finish, but not the foundation.
Right, it's just the paint job.
Exactly. But to be fair to the trend, there are specific scenarios where this instant approach genuinely works, is clinically sound, and won't, leave you with a mouthful of dying teeth.
Well, let's start with the good news then. Because I know if you're listening right now, you might be looking in the mirror hoping you fall into this exact lucky category.
Yeah, everyone hopes they're the exception.
Right. So when does this dream scenario actually hold up? Like, when can veneers legitimately act as instant orthodontics?
What's fascinating here is the way modern dental technology handles minor misalignments. And the operative word there is minor.
Minor. So not like a mouthful of crossed teeth.
Right. We're talking about slight spatial imperfections. Let's say you have a small, maybe 1 millimeter gap between your two front teeth, or perhaps one single incisor is angled just a tiny fraction of a degree backward compared to the teeth next to it.
Okay, yeah, just a slight quirk.
Exactly. In those highly specific cases, a veneer is a phenomenal, almost magical tool.
Right, because in those cases, you aren't actually having to move the living tooth itself to get the result, right?
Exactly. The root of your tooth, the biological anchor sitting inside your jawbone, stays firmly planted exactly where it has always been.
Makes sense.
What happens clinically, and this is standard practice at places like Vinnova Dental, is the use of advanced digital scanning. They use an intraoral scanner to map the microtopography of your mouth.
Wait, so they aren't using that awful goop in trays anymore to make molds? I hated that stuff.
No, it's entirely digital now. It shoots thousands of light pulses a second to build a hyper-accurate 3D model of your bite.
Oh, wow, that's pretty cool.
It's incredible.
Yeah.
And from those 3D scans, the clinical team uses a CAD/CAM design process to craft porcelain veneers into a perfect mathematically straight arch.
Okay, so it's all done on a computer.
Yes. Because that one tooth is slightly recessed or angled backward, the veneer is meticulously designed to build that tooth outward. They are essentially adding volume in porcelain so that it suddenly sits perfectly flush with the rest of your smile.
I'm trying to picture the mechanics of this. So it's essentially an optical illusion.
Pretty much, yeah.
It's like, imagine you're renovating a room,
Mm-hmm.
right? And you're putting a perfectly flat architectural facade over a slightly bumpy wall. The actual structural stud inside the wall hasn't moved an inch, but you've added a slightly thicker piece of drywall over the dented part.
I like that.
So to anyone walking into the room, the wall looks flawlessly flat and aligned.
That's a perfect analogy. It is a highly effective, beautifully engineered optical illusion. For those minor crowding issues or small gaps, It provides an incredibly fast solution.
Right.
You get the 3D scan, the porcelain is milled to those exact micro measurements, and the facade is applied. And here's the crucial part. The structural integrity of the wall, your living tooth, remains almost entirely intact.
Because they hardly have to touch it.
Exactly. The modifications needed to place that veneer are completely minimal.
And that brings us to the catch. Because the dream relies entirely on the misalignment being minor. But human anatomy isn't always minor.
Far from it.
People have severely overlapping teeth. They have profound overbites or teeth jutting out at weird angles, and that's where this whole instant orthodontics trend stops being a clever architectural trick.
Right, it stops being safe.
Yeah. If it's just an optical illusion, what happens when the underlying structural reality is severely out of place?
This is where we cross the line from a cosmetic procedure into a biological risk. To place a veneer under normal, healthy circumstances, a dentist has to prepare the tooth. You can't just glue porcelain directly onto an untouched tooth.
Right, or it will look incredibly bulky. If you just slap a 2mm piece of porcelain onto an already fully sized tooth, the patient is going to look like they're wearing a sports mouthguard.
Precisely. It would physically push their lips out. You have to make room for the new material so it sits flush with the gum line, functions properly when you chew, and, looks like a natural tooth.
So they have to shave it down a bit.
Yes. In a minor misalignment, this preparation means removing a microscopic layer of your natural enamel, usually just 0.3 to 0.5 millimeters.
Barely anything.
Right. Enamel is the hard, protective outer shell of your tooth. It's essentially the armor. Shaving a fraction of a millimeter off that armor is generally safe. The tooth remains strong, insulated, and healthy.
Here's where it gets really interesting. Wait, I'm stuck on the physics of this.
Yeah.
If a tooth is pushed severely forward, like really jutting out of alignment, and you want to put a flat veneer over it to make it look flush with the rest of the teeth,
Yeah.
aren't you essentially taking a chainsaw to the front half of the natural tooth just to make it fit that straight arch? You wouldn't be taking off a microscopic layer of enamel anymore. You'd have to chop the whole front of the tooth off.
You've just hit on the exact hidden danger of the quick fix. Your alarm is 100% validated.
Okay, so I'm not crazy. That sounds super dangerous.
It is. If a clinician attempts to use a veneer to correct severe crowding or a tooth that protrudes significantly, they have to aggressively grind down the healthy tooth to create that flat surface for the facade.
Oh, man.
They blast right through the enamel armor. And once you're through the enamel, you hit the dentin.
And dentin is what exactly? The softer stuff underneath?
Yes, dentin is the layer beneath the enamel, and it's fundamentally different. Enamel is basically solid mineral, but dentin is porous.
Porous, like a sponge.
Kind of. It's filled with thousands of microscopic tubules that lead directly to the center of the tooth, the pulp. The pulp is where the blood vessels and the nerves live. It's the living, feeling core of the tooth.
So what's the actual biological consequence of grinding into that dentin just to make a cosmetic veneer fit?
It's a cascade of trauma, really. First, the high-speed drill generates intense friction and heat. When you drill deeply into the dentin, that heat transfers directly through those microscopic tubules into the nerve center.
Oh my God.
Yeah, it basically cooks the pulp. On top of the thermal shock, you're exposing the inner tooth to bacteria. When you traumatize a living tooth to that degree, the nerve becomes incredibly inflamed. It's a condition called pulpitis.
That sounds incredibly painful.
It is agonizing, and often it's irreversible. The nerve simply dies.
Wait, the tooth just die?
Yes. And when the nerve dies, the tooth loses its blood supply and becomes brittle. Now, you need a root canal to hollow out the dead tissue, and the lifespan of that tooth has been drastically shortened.
Unbelievable.
So by grinding down a severely crooked tooth to force a veneer to fit, you are literally trading a lifetime of biological health for a few weeks of cosmetic speed.
That's terrifying. You walk in wanting to look great for a wedding, and 5 years later, you've got dead nerves, root canals, and teeth that might actually fracture because they've been hollowed out.
Which is exactly why the clinical philosophy at places like Vinnova Dental is strictly conservation first. A smile has to be biologically healthy underneath the surface.
Yeah, obviously.
It does not matter how stunning the porcelain looks on the outside if the biological foundation is die on the inside. Taking a shortcut might give you a fantastic selfie today, but the biomechanical reality is going to catch up with you.
It always does.
You're setting yourself up for complex, expensive, and completely irreversible complications down the line.
Okay, so this creates a massive dilemma for you if you're listening to this, and you've got moderate to severe crowding. We've established that aggressive shaving, destroys the living tooth. It's a biological nightmare.
Absolutely.
But people with severe crowding still want that flawless veneer look. They still want the customized shape, the bright color, the perfect symmetry that only porcelain can provide. So what's the move here? Are they just out of luck?
No, they aren't out of luck at all. But they do have to change their timeline, and they have to respect their anatomy.
Okay, so there is a solution.
There is. This brings us to a highly strategic hybrid approach, known clinically as pre-restorative alignment. It is the perfect compromise between the aesthetic goals of the patient and the biological requirements of the teeth.
Pre-restorative alignment, so aligning the teeth just enough before you restore them with the veneers?
Exactly. Instead of jumping straight into the chair with a high-speed drill, the process begins with a brief, targeted phase of orthodontics using clear aligners.
Wait, if they're using clear aligners, aren't we just back to traditional orthodontics?
Yeah.
I mean, I thought the whole appeal of veneers was to avoid wearing trays for 2 years.
Right.
If I wanted to do 2 years of Invisalign, I wouldn't be asking for veneers.
This raises an important question, and it's the exact distinction that most people miss. In this hybrid approach, the goal of the clear aligners is not to achieve 100% perfect cosmetic alignment.
Oh, really? Because usually that's the whole point of orthodontics, to make them look perfect.
Right. Traditional orthodontics can take years because the dentist is trying to get every single tooth perfectly rotated, angled, and vertically positioned to look cosmetically flawless on its own.
Which takes forever.
It does. But in pre-restorative alignment, we don't need cosmetic perfection from the trays. We just need to get the teeth out of the danger zone.
The danger zone meaning protruding too far or overlapping too much.
Yes. The goal is simply to untangle the teeth, to move them from a severe misalignment into a safe, functional baseline position. We just need to pull that jutting tooth back into the arch or uncross those two overlapping front teeth.
Okay, I'm following.
Because we aren't aiming for absolute micro-aesthetic perfection with the aligners, this phase is incredibly fast. We might only be looking at 3 to 4 months of wearing trays rather than 2 years.
So the aligners just get the teeth into the right neighborhood.
Precisely.
It's like if we go back to our construction analogy, you can't build a straight house on a deeply crooked foundation. The clear aligners are just doing the heavy lifting to pour a solid, untangled foundation.
Yes.
They do the hard structural work of getting the load-bearing walls straight, and then, once that foundation is biologically safe, the minimal prep veneers are the beautiful architectural finish built on top to give you that red carpet look.
That's spot on. The clear aligners do the heavy lifting specifically to protect your enamel. Think about the geometry of it, because the teeth are now physically sitting in the right neighborhood. The dentist no longer has to chop off the front half of the tooth to make the veneer fit.
Oh, I see.
They only have to remove that safe, microscopic 0.3 millimeter layer of enamel.
Because the tooth is already tucked back where it belongs.
Exactly. You don't have to drill into the dentin, you don't expose the microscopic cubules, you don't heat up or traumatize the pulp, and you don't risk nerve death.
That is amazing.
The dentist can safely preserve the biological vitality of the tooth while still delivering the flawless shape, the permanent bright color, and the perfect symmetry with the porcelain veneer.
It really is the best of both worlds.
Yeah.
You're combining the heavy lifting of orthodontics with the instant perfection of prosthodontics.
It is, but it requires a very specific mindset from the patient. It requires an essential trade-off. You're trading a tiny bit of patient, say, 12 to 16 weeks of wearing clear aligners for a smile that guarantees a lifetime of health. You get the stunning magazine cover aesthetic result of the veneers, but you aren't permanently mutilating your own nervous system to get there.
So what does this all mean for you, the listener? Because right now, you might be standing in front of your bathroom mirror, pulling your lip back, trying to figure out if your specific crowding is minor enough for instant veneers or severe enough to require this hybrid aligner approach.
Yeah, people try to self-diagnose this all the time.
How do you actually navigate this?
The hard truth is you absolutely cannot diagnose this yourself in a bathroom mirror. The margin of error we are talking about here is measured in fractions of a millimeter.
Right. It's too tiny to see.
The difference between what is safe to mask with an optical illusion and what will require drilling into your dentin is incredibly precise. The only way to know definitively which camp you fall into is through a comprehensive clinical assessment with advanced technology.
Which goes back to the digital scanning we talked about earlier. You need a professional to map the exact topography of your bite and do the math.
Precisely. Advanced digital scanning allows a clinical team to simulate the outcome before a drill ever touches your mouth. They can actually show you the 3D model on a screen.
Oh, that's wild. You can see it beforehand.
They can say, look, if we try to put a veneer on this tooth right now, the software shows the drill intersecting with your nerve chamber. It takes the guesswork out of it entirely.
That is such an incredible use of technology.
And this is exactly the workflow that the clinical team at Vinnova Dental uses. They utilize these advanced intraoral scans to walk patients through their unique options based on biological facts, not just, cosmetic wishes.
Right.
You can actually go to vinnovadental.au to book a consultation where they provide this kind of expert guidance with absolutely no pressure. They'll show you the literal math of your own mouth so you can make an informed decision.
That's such an important step. Getting the hard data before you make an irreversible, permanent decision about a living part of your body.
If we connect this to the bigger picture, critical thinking is absolutely essential here. As consumers, we have to look past the instant gratification cycle of social media.
Yeah, because it's a trap.
Exactly. Social media algorithms don't care about your dentin. They don't reward the slow, invisible reality of long-term structural integrity. You have to be your own advocate. You have to advocate for the biomechanical health of your own body over the temptation of a quick fix that looks good on camera today but hurts tomorrow.
I love that framing. We have to be our own advocates, especially when the marketing is so loud. So, to recap this deep dive we've been on today, veneers are undeniably a phenomenal tool.
Incredible.
They are a miracle of modern cosmetic dentistry and material science, but they are an architectural finish. They're the drywall, they're the facade. They are not a structural substitute for severely crooked teeth.
No, they are not.
If your foundation is tangled, you've got to do the heavy lifting to straighten it out before you put the beautiful finish on top.
And that leads to a much broader reflection, really. We've spent this entire deep dive looking at how the intense pressure for instant aesthetic perfection can tempt us into making truly dangerous decisions.
Like permanently grinding away the vital nerves of our teeth.
Exactly. Just to skip a few months of aligners, it forces us to ask a bigger question, I think. What other areas of our physical health might we be secretly compromising today, just to achieve a temporary visual filter for tomorrow?
Wow. That is definitely something to chew on. No pun intended.
Right.
Thank you so much for joining us on this deep dive. Keep learning, keep questioning what you see on your feed, and remember to look beneath the facade. We'll catch you next time.